Hey there, it's Carly with another episode of the Expat Focus Podcast. This past year has really put our health and well-being in the spotlight. Whether it's been dealing with a COVID-19 diagnosis ourselves, supporting loved ones, or dealing with the mental and physical health impacts of long-term lockdown and significant lifestyle change. Health service providers have played a key role during the pandemic, and my guest for this episode is from one of our health partners here at Expat Focus, Cigna Europe. Dr. Peter Mills is going to talk through the ways in which they've evolved as an organisation to support the needs of their customers, what types of services have been in demand during the crisis, and he's going to answer some listener questions. Dr. Peter Mills, thanks so much for coming on the podcast today.
Thank you very much, Carly, for inviting me. It's a pleasure to be here.
Now, it's no doubt been an intense year for international health service providers like Cigna Europe. How has your company been supporting expats and their families during the global pandemic?
I think you've actually used the word that we have really been focused on over the past 12, 15 months. It's been about support. Right from the beginning, we put our heads together and said, how can we support our members, our customers around the world? What do they need? What can we do to alleviate some of the stress, the anxiety, the uncertainty that the pandemic was bringing? But not only our customers and members, but also our own employees, because we've got thousands of employees around the world as well. So really our mantra was support.
And I'm assuming you've been involved quite a lot when it comes to people who have found themselves in situations where they've needed to call on their health service providers.
Absolutely. So what became very clear early on was that a number of individuals, a number of companies, their employees, they were in the dark. They didn't really know what to do. So the first thing we needed to provide was information and guidance in terms of, okay, where are you in the world? What's the pandemic like there? Where can you get testing? Where can you be treated if you do get COVID-19? So it really was quite a complicated endeavor to look at the different areas of the world and to provide that initial information that people were craving.
And so many moving targets too, because COVID hit so many countries in different ways at so many different at different time scales as well. So I'm guessing that would have been quite a challenge.
Absolutely. You know, it started, as you know, in Southeast Asia. And then the concerns at that time were, should I leave? If I don't leave, what happens if I get unwell? Where should I go? Can you evacuate me from this location if the worst comes to the worst? So it really was a rolling process of assessing what was happening in different regions and then putting together the information base that we could disseminate out to our customers around the world.
And so many industries had to change the way that they did things over the last 12, 18 months to accommodate how the crisis evolved, the different lockdowns, how to keep people safe. And healthcare, of course, had to really, I hate to use this word, pivot.
Yep.
You know, I know for myself, suddenly, instead of going to the doctor's office, I was booking video calls to see my GP and to get my prescriptions and make sure I was up to date with tests. How important has that pivoting been in the healthcare industry?
I think it's been, we will look back on this time as that point in time where healthcare transformed. I've heard the pandemic be called a tragic innovator, and I think that is what we will take, or one of the things that we will take from the pandemic is how it forced the healthcare industry to really think differently about how we deliver care and support to our populations. At Cigna, we started our journey actually before the pandemic. We had a vision to be a whole health partner. And what we mean by that is that we wanted to move away from being just the company that paid the bills, if you like, that facilitated point of care solutions. We wanted to transform, and we want to transform into a health services company that is there to support and guide people in their whole health journey, all the way from staying well to managing acute conditions, but also managing chronic conditions and survivorship as well. And we recognize that it's not just about physical health. And I think if we take away one key message from the pandemic, is that our psychological health is so important, and it really does drive how we feel in ourselves, how we work, how we interact with others. So our whole health strategy really recognizes that health is not just the absence of disease, but actually it's the summation of a number of different things within our life: our physical health, our mental health, our home environment, our finances, our relationships with our family, our social connections, our place in society. And although that's not necessarily a new concept, I think it's a new concept for healthcare organizations such as Cigna. So we're really driving forward on that. As I said, we started that journey before the pandemic, but the pandemic just accelerated the urgency for us to really change our relationship and what we provide to our customers.
I think that whole health perspective is something that I know myself, I've been really reflecting on over the past 12 months, so much time at home to really consider what is important to me, and am I looking after myself, not just from a medical perspective when I'm ill, or, but how am I going, as you said, with my mental health, with my relationships and that sort of thing. It's been a really big time for pause and reflection. And it sounds like Cigna Europe has been in a really good position to help people reassess their priorities and give them some solutions.
Absolutely. I think so many people have taken from this situation the ability, if you like, or the permission to really reflect on what is important to them in life. And many people have really struggled during this period of time, and it's not surprising really, because pretty much all of the pillars of whole health, all of the things that we know go to make up our health, have been impacted. At least, some people have had more impact than others. But all of the areas have been impacted. Our work life, our social life, our connections with our community, our family relationships, our finances. In many situations, people being furloughed, people losing their jobs. The uncertainty around it has been really quite profound. Like I said, we are on a journey as an organisation. I don't think we are there at the end point, if you like. But what we're trying to do is really trying to engage our existing customers in a dialogue around how can we help you? How can we provide for you solutions, services, guidance, advocacy that will help you to become more healthy?
And what sort of solutions and services have you seen increasing in popularity, particularly among expats and their families in the past year?
So you mentioned one, Carly. You mentioned the telehealth side of things, which has been really beneficial during this period of time. We've seen a 600% increase in utilization of our telehealth solution, of our global telehealth solution over the past year. And although pre-pandemic, there were people engaging with it, the engagement level was relatively low. People were still much more comfortable with the traditional bricks and mortar approach to
go in person to the doctor's office,
accessing care. The pandemic forced many people in different regions around the world to actually engage with telehealth. But I think one of the great things about it is that the overwhelming majority of those people were really happy and really satisfied with it. We've got something like a 96, 97% satisfaction rate, people rating it very good or excellent. So, and I think this has been transformative, and it's got us thinking about how can we blend traditional care, so, as we say, in-person bricks and mortar care with virtual solutions. So not resting on our laurels, we're really looking at other virtual solutions that we don't want to replace face-to-face, but can potentially be used to augment and support face-to-face care. So a good example is virtual musculoskeletal care, physiotherapy.
Oh, really?
There's been a tremendous explosion in organizations that are offering virtual solutions. And in some ways, the digital approach is better. If you take, for example, going to see a physiotherapist because you've got pain in your knee, you'll go and see the physiotherapist. They'll assess you. They'll give you some exercises and tell you to come back in a few weeks after you've done those exercises. No one really checks up on whether you're doing them. You can't really remember exactly how you're going to do them. Exactly. And research shows that at least 40%, possibly even 60% of people who are given a course of physiotherapy, self-directed exercises, at least 40% don't complete that course as prescribed. The great thing about the virtual setting is that you can have videos and instructions that are tailored to you. So if your physiotherapist says to you, okay, you need to do these 4 exercises, you can refresh yourself with them there. You can also have real-time check-ins with your physio who can ask you, okay, what's going on? Are you doing your exercises? How are you feeling?
Or demonstrate to me how you've been doing.
Exactly. What's your pain level like? And then some of the more elaborate solutions are actually using sensors and bands that you can put on yourself. So the physio has a record of actually what you've been doing and whether you've been doing the exercises correctly. So it's a fascinating area of how technology can really augment what we've come to know and love, but actually can improve it. So we've got a team within Cigna that are actively looking at new innovations that we can bring to the marketplace for our customers, again, to help them with their whole health.
It's really interesting because as soon as you brought up the physio example, I thought, there's no way, because there are some health services where you really need to be there in person to be examined, for example. And I thought something like physio would have absolutely been one of those. But the way you explained it, and when I think about, I've just gone through physio actually for a back injury. And other than a little bit of prodding on the table, most of the time we're in the gym, he's showing me some moves, giving me new things to do at home, checking, my position and my posture. And so much of that, and as you said, with like a sensor sort of technology, could be done virtually.
Absolutely. And like I said, it doesn't preclude the face-to-face. And I think the real opportunity and the thing that excites me is that it can be additive and augment the face-to-face. So you may go and see a physio at the beginning and at the end, but in between time, you've got these virtual check-ins and this virtual solution that can guide you.
So convenient. I mean, for expats that might be living in a rural area away from their regular doctor or specialist, it reduces the need to travel. It means that they can be accessible without needing, to really change their schedule to do that. I think about my GP checkups that I've had over video in the past 12 months. And I think really, unless I need a physical examination, there's no need for me to ever set foot in my doctor's office again, because we can do so much over video now.
Indeed. And I think, this is where the opportunity lies, and where we as a health services company really are actively engaged in terms of, like I said previously, moving away from just being that organisation that helped you find a hospital, a clinic, a doctor, and then paid the bills, to being your guide, to, if you like, I've used the word already, advocate, be your advocate. Let's help you make the right decisions. Another area that I think is really interesting, and that we've seen a lot of excitement about, excitement is probably the wrong word actually, a lot of interest in, is digital mental health, psychological health solutions. Without a doubt, the pandemic has had a profound impact upon people's emotional health. And because many clinics, many hospitals around the world have been limiting the number of people that they've been able to see, just because in many cases they've been overwhelmed with COVID, the virtual side of things has really taken off. And I think it's an area of healthcare that really does lend itself to virtual and digital solutions, because a lot of the treatments are talking-based treatments. And increasingly, psychological health professionals are moving away from here's some medications, they'll make you feel better, to actually let's get to the root of the problem and let's really talk through this, and let's give you the tools so that you've got much better coping strategies as an individual. And we've seen an increase in people coming through us as an organisation saying, can you help me find a psychological health professional who will be able to help me? It's really stressful. Homeschooling the kids. Work has got me working, completely virtually, but I haven't got the setup there.
Really
I'm worried about my elderly relatives back home, what's happening with them. There's been so many stresses, and we really have seen quite a marked increase in claims and requests for help around that area. So again, another area that I think the virtual side of things can augment the more traditional face-to-face.
Peter, I have read some articles about during this pandemic, with people not being able to go in to their doctors in person, or, being under curfew, being under lockdown, they haven't necessarily kept up with important tests, for example, for cervical cancer for women, or diabetes, heart disease. How is health service provider support evolving for people with chronic conditions, and how are health service providers making sure, or playing catch up now, to make sure people are getting tested and staying on top of those sort of health issues?
Absolutely. We've heard lots of stories about health systems around the world where the fear is that there'll be a lot of people who've been sitting on symptoms that are potentially life-changing in terms of the underlying diagnosis, cancer, cardiovascular disease, maybe their diabetes hasn't been managed as well as it should have done. One of the things that we wanted to make sure we did with our customers was to reach out to them at the beginning of the pandemic, when it was clear that countries, geographies were shutting down, when it was clear that the healthcare system was not really going to be able to cope with much more than just managing acute infections with the coronavirus. We got our nurses to reach out to people that we knew had chronic conditions, to make sure that they knew what to do, they knew where to get their medications, they knew that we had a telehealth service, they knew that they had at the end of a telephone line a nurse as well at Cigna who could help them make decisions if needed. So for those individuals with chronic conditions, it really is, and even though I work for Cigna, I think, it really was a great solution, or a great service, if you like, for them. So to have someone checking in on them, making sure they're okay. The real problem, as you alluded to, is those people who didn't know they actually had an underlying condition. And one of the things that we've been doing of late is communicating out to our membership base around the world, saying, health services are open, or in this region, so health services are open. If you're sitting on any symptoms, if you are concerned about any signs or pains, whatever it is, get in contact with us. We can find you someone who will be able to see you, or worst comes to the worst, do a virtual consultation so that you can explain to the doctor, to the healthcare professional, what your symptoms are. So what we've been trying to do is be proactive with these people to support them, to help them make the right decision if they do have underlying symptoms. But the research and the data that's coming out does suggest that there's going to be a significant number of people who are being diagnosed with chronic diseases later than they normally would have been if it wasn't for the pandemic.
Now, Peter, this week we did ask Expat Focus listeners via social media and the Expat Focus Facebook groups to submit their questions for you, and I have some here. The first one is from Alicia, and she says, I see there are many health service providers for expats, but how do I know if they're reliable or not?
That's a good question. And one of the things that we've been doing at Cigna has been really looking in depth at healthcare quality. Because you're right, and especially if you are abroad, you're away from your home country, you don't really know a lot about the healthcare system where you're at. So an organisation like ours can help you make the decisions that are best for you. Is this clinic, is this hospital, are they good? Do they have an acceptably low complication rate, hospital-acquired infections? So one of the initiatives that we've been running for the last 2 years is what we're calling our provider segmentation program. So we've got a wide network of providers where we have direct billing arrangements, but we're actually now segmenting these down to those ones where we are really happy with the quality and the governance of the facility. And increasingly, what we're going to be doing is surfacing these to our expats around the world within the Cigna portal, so that they can see, okay, here's some metrics around this provider. This is the number of a certain condition or a certain procedure that they do. This is the complication rate. This is the customer satisfaction or the patient satisfaction metric. So we want to really be much more transparent. And we're really trying to encourage our networked and our contracted providers around the world to be more transparent. Because ultimately, at the end of the day, these decisions are really, really critical to individuals. And without data, people are making decisions based upon, I like the fountain in the foyer, or the espresso is really quite tasty, and it's crazy, isn't it? We spend more time.
A bit of a worry if you're making your decision.
We spend more time researching where we're going to go for dinner than we do which doctor or which facility we're going to go to. So one of the things that we're bringing to the table is much more transparency around that. Let's help you make a decision based upon your needs, your individual requirements, and what it is specifically that you need doing, because some places are good for some things, other places are good for other things.
And let's face it, when you look at reviews and ratings online, a lot of the time people only take the time to give their opinions when they have a negative experience as well. So sometimes it can be hard to get an accurate gauge of, well, was that clinic or was that surgeon any good, or did they provide adequate care?
Yeah.
Another question we've got here is from Simon, and he wants to know, is COVID-19 treatment covered by health service providers? We know, here in France, for example, they're giving out the COVID-19 vaccination free, and I'm sure that's the case everywhere else in the world, unless I'm mistaken. But what about if you do have COVID and need to be treated, worst case scenario, a hospital stay?
Yes. So one of the things that we did really early on in the pandemic was communicate out to our customers, to our employer clients, to say COVID treatment, COVID testing, if there's a medical suspicion that someone has the coronavirus, is completely covered. There's going to be no co-pays or anything, any out-of-pocket expenses for the testing and management of COVID-19. And I think that's really important, because I think a lot of people were really concerned, and to give them just that little bit of peace of mind in terms of, you don't have to worry about costs. For many expats, their healthcare policies are very rich and very robust. But in some areas around the world, maybe some local nationals, or in some countries around the world, such as the United States, even rich policies have co-pays and deductibles within them. So we wanted to make sure that we completely leveled the playing field, that people didn't have to worry about that.
Now, we've received quite a few questions about coverage eligibility and where to get certain treatments in particular countries. That's probably a bit too specific to get into in this conversation, but what can you suggest for these listeners who are interested in that sort of information?
I think, the thing I would encourage people to do is talk to their health insurer. So if you're covered with us at Cigna, you'll have a helpline, an email address, web portal, etc. Other organizations, probably similar solution. But talk to your insurer to get some help and advice in terms of where to go based upon your location, based upon what your particular need is. And they should be able to provide you with some good information.
And if you're not with Cigna, but you'd like to know about what this health service provider can cover, I'm assuming there's a lot of information on your website as well.
There's a lot of information online, information about our network of providers, just go online and do some searches. I'd like to say that we were a lot better than our competitors, but I think we're kind of in terms of our online presence. In terms of our online presence, they are in terms of the public information that's available. It's quite similar.
My final question for expats and their families that may be looking to change or upgrade their international health insurance, particularly in the wake of the pandemic and what they've been through in the past year. Many may have decided their current coverage is not quite adequate for what they need, or as we talked about, in light of whole health, they're looking for more out of their policy. What would you suggest is key for them to look for when they are considering a new policy?
So that is a broad-ranging question, I must admit. But I think people need to take time when they're thinking about the coverage and the solutions that they need for their own and for their family's health. It is a complex area, and I think one of the things you need to do is sit down and almost write out what are the things that are important to me. Now, clearly, access to care is one of the key areas. So you need to be confident that whoever is providing your health services solutions for you, which includes the insurance, that they can provide you with good access to care in the regions around the world where you are. Okay, that's the first thing. But then, as you said, Carly, what are the additional areas that are important to you? In terms of your own health, well-being, that of your family as well. And that's where I think, you can start to think about the whole health concept. Okay, additional psychological health support. One of the things that we often see with expat families is the main member on the policy is there. He or she is an expat with a major corporation, and they bring along the family, the spouse, the children, etc. And often we see problems that occur within we sort of colloquially called the trailing dependents, so it's really worth thinking about that as well. What's the coverage? What's available for those individuals as well? I think the psychological health side of things is really important. It's really stressful going out on an expat assignment, you are in a new country, possibly with a new culture, and without that support network that you used to back in your home country. So there's so many different things to think about. But really, I would encourage people to sit down and think through things and take their time to do it as well, because it's not as easy as booking your restaurant and where to go. It really does require some thought. And look around as well. If you are an expat, you're most likely going to be employed by an organisation that is providing you with your healthcare services. Talk to the benefits people. Ask them, questions about, okay, what is it that this organisation is going to deliver to me? What are their unique selling points, etc. So.
Well, Peter, thanks so much for your time today. It's been a pleasure chatting.
Thank you very much, Carly.
That's it for this episode. If you'd like more information about Cigna and the services they provide, head over to their website. It's cignaglobal.com. If you like what we do here on the Expat Focus podcast, please follow or subscribe to the show however you like to listen. Remember, you can contact us at any time on social media. We are Expat Focus. Our website is expatfocus.com, and I'll catch you next time.